Today we got to speak with Kian Habashi. He is a first year resident at the University of New Mexico Department of Orthopedic Surgery. He talks about his own journey, gives us advice, and he also touches on that transition period between medical school and residency. With that, we'll get into it. Thanks for hopping on.
Yeah, of course. Sorry for being a
Yeah.
little late.
Oh, you're good. I'm just glad you could make it. Also, congrats on step three. It's pretty big.
Thanks, man. Yeah,
Yeah.
stuck on it. I mean, I guess we'll see what the score is next week, but
Is it scored? Like they give you a number score?
yeah, you do get a score, but yeah, I mean, it matters for like IM specialties and,
Mm.
ones that have like really competitive kind of fellowship matches, but for ortho, it's like optional. You don't even have to put it on your fellowship app.
Oh, I see. Okay.
Yeah. So basically,
Um, I made you co-host. I think you can record now. Does it have the dashboard for you?
yes, sweet, perfect.
Sweet. Okay. And yeah, for those in here that don't know me, my name's Tony. I'm a third year. I was in the ortho board last year. We did a meeting just like this with Matt and Hannah and posted the video as well. And Keon may post some of this video too. Um, he's got a couple more followers than me on TikTok. So don't let that discourage you guys from asking questions, though. You can type in the chat. At the end, we'll have time for that. You can type it in the chat. You can just DM me after and say you don't want to be on the video, and we can figure that out too. It's not a big deal. Um, Other than that, we'll get rolling. Getting some water in.
Yeah, dude, I've been running around all day. We just
Long
got
day.
back from a pretty cool lab. So Wednesday evening we have didactics. It's like resident led, and we usually have labs, and the reps will host it, like Stryker, Arthrex, and like get us food and beer, and we just like drill some sawbones. It's
There you
pretty cool.
go. That's fun.
Yeah.
Every Wednesday, you said?
Every Wednesday, 6 to 8 p.m. Well, like in our time. Yeah, it's like laid back, like teaching, like a lot of pimping and stuff, but it's like low kind of stress. It's just like a lot of teaching.
Oh.
Yeah, free food, free beer, labs. So it's fun.
Is that something that a lot of programs do?
Not like this. Yeah, if you guys don't know me,
Yeah,
I'm
yeah. Yeah, we'll have you introduce yourself here.
yeah, I'm one of the PGY ones at University of New Mexico Orthopedic Surgery program. Super stoked on it. Big proponent of UNM as a great program. Like they were my number one choice. They were our number one choice for like three of the other interns too. So definitely could talk about like that program specifically if anyone has questions about that.
Yeah. Just building on that, just learning a bit more about you, starting with undergrad. Where'd you go to undergrad? Where'd you go to med school? Did you take gap years? And actually, a follow-up, like where along there did you first get an interest in orthopedic surgery?
Yeah, for sure. So I think high school was probably my first introduction into like orthopedic surgery. Had like like a lot of kind of ortho stories, had like my own orthopedic injury, like tore my labrum, got surgery for it, just thought the mechanics of the surgery was cool. I recovered really well from it, thought it would be awesome to be able to change someone else's life like that. That was my first kind of intro into it. So I went to undergrad so I'm born and raised in Las Vegas. I went to undergrad at UNLV, University of Nevada, Las Vegas, did med school there as well. And then now I'm here. So yeah, just kind of stayed at home. Priority was like, let me be in the place that I can concentrate the most, have the best social support system so that I can, try to do my best and, match into this competitive specialty, try to save some money along the way. So
Yeah, I agree with that. I live by family too. It's very helpful.
yeah, it is nice.
Yeah. And so ortho, you kind of had an idea in high school, you said?
Yeah, yeah, I would say so. I kind of knew medicine was going to be like my path from like pretty early on. Definitely something like procedure heavy, just like loved working with my hands from like an early age. But I mean, once I got some more exposure to the specialty itself, like in undergrad, when I got to shadow some orthopedic surgeons, when I was in the operating room, it was just ortho is like one of those specialties where you can really change someone's life in such a small amount of time, like a couple hour procedure. I mean, I saw like my grandma get her life back completely after like bilateral knee replacements, and she's like 82 years old and walking around, doing work around the house, like can do everything pain-free. Like seeing my uh like I literally saw my dad get into like a horrible accident. He couldn't walk for weeks, and now he's like able to, go on hikes with me and still have his like life completely back. Like it's just one of those specialties that you can really fix someone rather than just kind of managing something more chronic, you
Gotcha.
know?
Yeah. Did you ever consider other specialties or, you've had these early experiences which helped a lot in your family members as well, but did you ever consider anything else during medical school?
Yeah, definitely. So I was around sports a lot of my life. So I always thought like, a family medicine route to like sports medicine could be cool, or EM to sports medicine. Um, or, something else that's like operative, like plastics or gen surge. But I don't know. I kept coming back to ortho because one, like a lot of my mentors, right? Like a lot of the people that I spoke to that were in ortho, some of the surgeons and proceduralists that I saw that were actually like really happy and like had some kind of work-life balance, had some kind of life outside of the hospital. And you can't say that too much for that many procedural specialties. So that was a big reason. And then something else too, I was like, okay, maybe I just like the OR, maybe I go into like anesthesia. I can do some procedures, put some A lines in, two people, that could be fun. But man, I just thought I would get so much FOMO from behind that curtain while like I hear drilling and hammering and like, you know, people having a good time and like fist bumping, behind the curtain when they see good x-rays. Like I just really wanted to be in the action. I wanted to work with my hands. I wanted to fix people and, somewhat still have a life outside of the hospital too.
Yeah, the versatility of ortho I think is cool, and you can have balance after residency, especially.
After residency, yeah.
Yeah.
Right now it's a bit of a grind and in med school, but
I want to talk about that though, because you've just made this transition from M4 to residency. What is that
yeah.
experience like? How does it feel? What are some of the difficult parts about it? And what are some of the parts that you've loved about it thus far?
Oh man. So first off, it is so much better than being a med student. Like there is such a light, a bright light at the end of the tunnel. Like to have a real position in the team where your work really matters day in, day out. Like as a med student, it's like whatever. Like, yeah, you try to help out, but like the team would run totally fine without you. And you know, there's kind of nice to not have as much responsibility, I guess, as a med student that way. But it's just so much more fulfilling at the end of the day, knowing that you were such a vital contributory part of a team. And I value that a lot in my day-to-day as a resident. And then, man, I gotta tell you, I mean, especially applying ortho, just like having some job security and kind of getting through that path is huge too. But yeah, also transitioning to residency is really freaking hard. It's like, I mean, if med school is like drinking from a fire hydrant, I think residency is like drinking from the Niagara Falls. Like you are learning so much, and especially ortho, like we're not taught like any ortho in
Yeah.
med school much, like at all. So now I'm trying to learn a completely different discipline at the same time as like learning how to put orders in and like how to like write notes the right way and how to interact and set things up in the hospital, like just things that you don't consider as a med student. Like, no, how do I get that patient that's in the trauma bay into a procedure room so I can reduce their fracture? And who gives them the ketamine? Do I have to call the respiratory therapist? Like, who do like do, at what point do I call my senior? Like, no one teaches you that stuff. So learning all of that is very intimidating. But overall, like just such a exciting and like just so grateful to be in this position now. It's a lot more good things than it is bad. It's intimidating at times, but it's so worth it.
Yeah, we have one question in the chat. Did you take a research year in med school? And if so, do you have any insight into the process?
Yeah, sorry, I forgot to answer that part of the question. So, undergrad to med school, I did take one gap year. Um, I mean, ERAS is, or not ERAS, getting into med school is like a full-time job with all the secondaries and all that. So, wanted to give myself time to relax before med school. And then in med school, I did not take a research year. No. I know they're very common. It's very common. I've heard like in dermatology, ophthalmology, I know it's very common. I can't say I know that many people. I know none of my co-interns took a research year. I can't say it's very common. Yeah, you can definitely increase the amount of items on your CV, some more research. Um, but also like they can see that you took that extra year to do that. It kind of speaks to your ability to kind of be more efficient and decisive and better with your time if you're able to be productive within that 4 year span of med school. Um, I don't think that it necessarily hurts or helps. I would say if you're absolutely not a good candidate for a competitive specialty, then it's like you have to do what you have to do, right? Like you have to take that year to be able to get up to that standard, and that's fine. But if you're like an M1 or M2, I would say probably just try to grind a little bit so that you can just apply without that research year because I don't think it's like looked favorably.
Yeah,
Yeah,
we've had some kids in our school do it. Our school is one that doesn't have a home program too, so I think a lot of students use it to go to another program and get experience and connections. And I think
I do agree with that, definitely.
that's somewhat of a reason that we see it at our school, but yeah, that's good advice there.
I think that's very important because honestly, like a lot of these competitive specialties, it is connections. It kind of is who you know, these relationships you develop. So yeah, if you're able to do a research year at like a program that you want to go to, and you're able to get and work in close proximity with someone that would have a say into your entry into that program later on, I think that is a very good use of time. Absolutely. Yeah.
And I also have a question. You talked about med school. We don't really learn much about ortho in medical school,
Hmm.
but how do you gear up for things like sub-Is, where you're going to rotate and you need to have some sort of a knowledge base? I know it's anatomy heavy, but what did you do to prepare in medical school and in third year to get ready for your sub-Is?
So just some background, Tony, on this. Is this like a lot of people that are interested in ortho or
Yes,
just,
this is the our orthopedic student interest group. So everyone in here
oh,
is
cool.
definitely interested. Yeah.
Nice. Okay. So, preparing for sub-I season. Yes, very important. What you learn in med school is not going to be helpful for you as a sub-I. So, you got to dial in your anatomy, and then it will be, so anatomy is huge just for knowing what you're talking about. And when you're getting pimped by the attending, being prepared for the OR, most of the stuff you're going to be asked is what nerve are you worried about? What artery are you worried about? So anatomy is at the forefront of your preparation for sub-I season. And um, so I'm a big Anki guy. That's how I survived through med school. That's like how I did well on my exams and step. And there is a really nice deck. It's called the Marty McFlyen deck. I could type that in too. And you can just like look that up. I think there's like a like Reddit post, and that has all of Netters for ortho turned into Anki flashcards. And it also has one of the other books that's very high yield for sub-I season, which is called Pocket Pimped. I'll type that into. And there is a book version of that, but that Marty McFly Anki deck, it has all of Pocket Pimped turned into flashcards as well as Netter's Anatomy. It's about 4,000 flashcards. And as soon as I finished up with step two dedicated, I did all of those flashcards and made sure that they were mature before sub-I season. And I swear to you, like Pocket Pimped, especially, it's like every question that the attending asked me was straight out of that book. And you're studying it and you think it's the most like outrageous random facts. And for some reason, the attendings always ask those same things. And this is at multiple institutions. So highly recommend that. If you do that Anki deck or you at least go through Netters and that Pocket Pimp book, you're good in terms of preparation for sub-I season from a knowledge standpoint. Now, that is your knowledge standpoint and what you know as a medical student, as a sub-I, is, man, probably 25% of the weight of what we weigh, at least for a student getting into our program. Knowledge is important. You want to know what you're talking about. You want to prepare for cases for sure. But work ethic, personality, time management skills, efficiency, those things are extreme, being teachable. Those are the things that you can't teach someone, right? You can teach anyone orthopedics. You can teach them what nerves not to hit, how to drill something, but you cannot teach those kind of personality traits. So someone that's showing up early and staying late, volunteering to do more, is able to anticipate what the resident needs and is about to do next. And someone that's able to balance all of that, being sleep deprived, being under pressure, and still kind of being calm and being a normal person on top of that too. Because we're going to be hanging out with you all day, overnight, sometimes 30 hours straight. And we also just want like a normal person to be able to kind of hang out with as well. So yes, definitely prepare for sub-I season. First off, it'll make sub-I season a lot easier because when you're prepping for cases, you're already going to know a bunch of stuff. But yeah, don't think that's kind of like the end all be all for how you're kind of evaluated as a medical student.
Got it. And building off that more, some of us were our first years, just starting, maybe have barely been in the OR ever before. What advice do you have for medical students entering the OR, maybe even for the first time or just very new in the OR, whether it's surgery rotation or with an orthopedic surgeon shadowing?
Oh yeah, for sure. So there are some like people that haven't stepped foot in the OR at
I
all.
I don't know that. I'm just students, at least maybe some first years that haven't had a lot of OR experience. So if there are students like that or any
Yeah.
listening, then what advice do you have for them?
Yeah, definitely. Oh man. So yeah, you gotta be very careful, right? You gotta make sure that you're introducing yourself to everyone. I would say, try to enlist like the help of like a senior or like a nurse or someone to at least like get your bearings a little bit, figure out where the lines are. There's gonna be a red line where you have to make sure you're wearing a scrub cap and you're not wearing your jacket and you have OR scrubs on, just the very basics. Make sure you're not like breaking like certain codes. Now when you step foot into the OR, right, room full of people that you don't know. The first person that basically like makes eye contact with you, go up to them, introduce yourself, and introduce yourself to the whole room. You're most likely going to have to put your name on the whiteboard, so offer to do that. Make it known, figure out if you're scrubbing in or not. Most likely, if it's like your first time in the OR, you probably won't be scrubbing in. So other basic things, mostly if you're the first time in the OR, it's like stay out of the way and be very cautious about what's around you. Don't touch anything blue because it's sterile. And that's basically it. Make sure you're like viewing from like a safe distance. Now, if you're scrubbing in, make sure you know how to scrub in, watch a YouTube video or something. A lot of the times that can just be done very early on in the day, like before anyone else shows up to the OR, basically. And then you can use like a sterile scrub after. But in terms of your first day in the OR scrubbing in, man, you got to be just asking questions all the time because every scrub tech's going to have their preference, whether you can drop your gloves onto the table or if they want to grab it for you or if they want to drop it. You are their guest in there. I mean, you are an outsider. You have to be very, very careful about your behavior in there and make sure that you're always asking. You can't be too cautious, is kind of what I'm saying. Um, and I don't mean to say that to like scare you or anything. Once you get these kind of steps dialed in and you start to know people, it'll become like second nature and comfortable. But I would say like your first couple times in the OR, just be very careful. And like sometimes someone will be scrubbing in and they'll hand you their tab so they can like spin around and like don't kind of pretend like you know what you're doing, like ask like, hey, I've never done this. Do I grab here? And they'll be like, yeah, just grab here, hold it tight, and don't move. People are very nice in there. If you ask, if you stay humble, if you don't come in hot, um, yeah, just kind of come in on your like toes a little bit. Come in carefully. I would say that's like probably my best advice and ask lots of questions. Yeah.
Cool. I also want to ask as we decide, as we move on, we get through sub-Is, or we're deciding where to choose to go to sub-Is, what goes into that decision process?
Important things that I considered for sub-I season. I kind of got a good look from my home program, my home ortho program in Las Vegas, and what I liked and what I didn't like. And I kind of went based off of that. And I learned that I wanted a very blue collar program. So we call them like blue collar versus white collar. Blue collar, the difference is kind of like blue collar is known for being very trauma heavy, very, I guess yeah, high load of patients coming in, staying up all night on your call shifts, with so many people coming in, the trauma ORs like backed up because they were so busy, and a very high focus on just kind of the ability to have a lot of efficiency in taking care of those patients and manual dexterity and tons of repetitions for both surgical and reduction and procedural kind of maneuvers. You get a ton of reps with those blue collar programs. But on the downside of it, they are historically less, um, there's less kind of research support there. So you won't be able to do research as easily or it won't be as available. But with that as well, there's usually less research requirements in residency. So for example, my program requires one research project for the entirety of residency for the 5 years. Another program that I was at requires a project every single year to be published while you're resident. So that's like the kind of different cultures of the program. And then culture as well, right? It's kind of known that some of these more East Coast programs a little bit more like white collar. Um, it can be a little bit more higher, be a little bit more of a hierarchy. You don't really address your senior residents directly as an intern. You first talk to the PGY2 or the three, and they step it up. And you're dressed up in a white coat and tie at ground rounds. The culture is a little bit different. Here at the University of New Mexico, my program director calls me dude when she talks to me. Like it's a lot more kind of laid back and that kind of culture. And, you know, it kind of just depends on your personality and what you're looking for. So those are some of the factors I was looking for that I did kind of want more of that laid back culture, blue collar vibe, kind of less research requirements, more emphasis on getting very good at surgery. And you're able to kind of get word of mouth to figure out those kind of programs. But there's actually also an Excel sheet. I'm sure you guys can find on Reddit. I'm sure people have access to it, where they do rotation reviews of basically all the programs you can think of to do sub-Is. Take a look at that. People, I would say it's pretty representative. It is pretty true of the places that I was at. So you can take a look at that as well to kind of get a feel for what some of these programs are like. So that was my process. Sometimes it is kind of a guessing game, and you have to just find a location that you like and you have other draws to it, and then see if you just like the program.
Got it. And now that you've started up, you're rolling into your program. What does like the logistics of residency look like? Like, what's the first week like? How do you begin? What are your first rotations, and how does it work? At least you can speak only on your experience, but how does that work as a first year resident?
So first week is just orientation. There's so much administrative stuff you have to do in terms of getting all of your IDs figured out and your uh, uh, two-factor authentication so that you can prescribe opioid medication. So it's like days of that. I have to get my ACLS, my BLS, kind of similar stuff to med school, a little bit more in depth. And then after that, that's like 3 days. After that, you kind of get thrown just right into it. It's like, okay, boom, you're starting sports medicine tomorrow. So I started on sports medicine and kind of felt like sub-I season again. So it's like, okay, you're going to be with this attending, this resident at this time. Look up the patients before, prep for cases. And I was like, okay, I kind of know how to do this. Just prep for my cases. But now I'm writing the brief operative report after, and people are helpful. The fellow would kind of take me through it for the first couple of times. And then you get graduated responsibility. In the second and third week of sports medicine, I was putting in the post-op pain protocols that they had to pick up at the pharmacy after. I was doing the brief op reports and the discharge orders and giving them ANSEF and the PACU. So it's graduated. I mean, you definitely get your hand held a little bit in the beginning. Definitely depends on the rotation that you're on, but I think like our program has for sure like really good mentorship as you're starting as an intern to make you feel kind of comfortable with the transition.
What do you have next? What's your next rotation you're doing?
So right now I am on physical medicine rehabilitation, PM&R, and it's very chill. Not much, not much to do during the week. But now this next 3 months, this next 10 weeks specifically, I am on ortho ward. So I am the point of contact for every single consult to ortho during the daytime from the emergency department in the trauma bay. And I also am like the point of contact for any patient basically like on the floor as well that's having any problems. So this is supposed to be like one of the hardest rotations of residency. Um,
Right.
and definitely intimidated. It's going to be a big learning curve, but man, it's going to be a blast because I'm going to get so many reps. I'm literally going to be the ortho contact for the ED. I'm going to get so many reductions in and traction pins, and it'll be a blast. Like it'll be an adjustment, but it'll be a lot of fun.
How do you manage like that increased level of responsibility? I feel like as a medical student, you really don't have much responsibility, and then you're kind of describing right now, you're thrown into a lot. Um, what are some things that you do to manage that and stay level, stay keel, and get through that? You just reach out for help. What are some things that you do?
Yeah, I mean, in the beginning, you just ask people to kind of double check you. When I'm putting in orders, my seniors next to me, I'm like, hey, does this look right here? Does this look right? I mean, it took me way too long to order Tylenol the first time. I've never put in orders before, residency. But as you start doing it more and more, you just start getting comfortable. And after getting your hand held through those first couple of ones, I think it develops your confidence. Yeah.
Do you know what you want to subspecialize in? I know it's early, but do you have any ideas?
Still early. I mean, yeah, I love trauma. Spine is cool, joints is cool. Yeah, I mean, we'll see. Very open minded right now. Lots
Yeah.
of time.
Could you, I think that'd be a good idea. Just kind of go through some of the subspecialties in orthopedics. If there's anyone listening or here that doesn't know the breadth of it, and just go th through each of them and kind of describe, what they do.
Sure.
Yeah.
So you have orthopedic trauma. So these are the people that are taking call at the hospital usually, like they are the attending on call overnight. So anything that comes in overnight, they either have to come in, but usually ortho, there's not that many true emergencies. So they're taking their next day is all the people that came in overnight with orthopedic injuries. And that is everything. I mean, it's basically like head to toe. They can really operate on any part of the body, but their specialty is pelvises. So they do a lot of pelvis fracture fixation, which no one else will touch. Ortho spine, self-explanatory, scoliosis surgeries, decompression surgeries. They do a lot of trauma too. You know, if someone has uh, like a compression fracture or, urgent spine things that come in overnight, they also have to take call. Ortho hand, that could be a large variety of things. People can take it all the way up to the elbow. People can take it to the shoulder. And then there's shoulder elbow. That has some overlap with sports medicine, which also does a lot of shoulders, but they also do knees, hips. And people think sports medicine is a lot of cameras and arthroscopy, but there's actually a lot of cool, like open stuff. Like you actually do use like a saw quite a bit. You are having some big exposure sometimes. Um, there's joints, so hip and knee replacements, and then there is oncology, so bone tumors. That's a pretty crazy one. I think that, and then foot and ankle. I think that covers it. Yeah.
Yeah, I feel like onc is kind of a totally different thing. It's do all programs have all of these specialties? Because I know we're applying to fellowships afterwards.
Hmm.
Go to a program, could you typically get into any fellowship that you want, or is there ever a program that's, better for this type of fellowship? Does that go in your thinking at all?
Yeah, you can pay attention to that getting into residency programs for sure. I think there's still ability to get into any fellowship you want to, but it might be harder. Like,
Yeah,
um, our program is really known for its sports medicine and spine matches. Like we have such good mentorship in those couple of specialties, and people usually do really well with their fellowship matches in those specialties when we match a lot of people in those. So yeah, I mean, it's good to pay attention to that. It's kind of hard because I think a lot of people change their mind in residency, so don't use it too much to dictate your decision on residency. But yeah, it's something to look out for.
are there competitive fellowships? Are some more competitive than others, or is it kind of not really like that?
As far as I know,
Yeah.
not really. Maybe oncology requires a little bit more research,
Okay.
but I wouldn't say so. Honestly, like fellowship matches, once you're in like ortho, it's basically just like word of mouth, like who your mentors are and who they can reach out to for you. Ours, residency is cool. We actually have an elective, basically like an away during med school. You can go off for like 10 weeks and go work go do ortho wherever you want, and people take that time to go do it at a place that they'd want to match fellowship.
I got it. All right. If anyone else has questions, they can ask. Sorry, I've been talking for a while here. And if not, we can wrap things up pretty soon too.
Cool.
Cool.
All
Um,
right.
Sorry, I have a question. I was gonna type it, but it's taking too long.
Yeah, no worries.
Thanks for putting this on. But I just wanted to know if, I don't know, like publications, abstracts, that type of stuff, like how many you had, and like I would say like your maybe the average that your class had, and then maybe how many like you were first author on?
Man, I'm gonna have to bring up my CV here. I could probably tell you like just in general. Maybe I could, I don't even remember now. Let's see. Yeah, so research is, I would say, pretty important for ortho. You know, like I'm not gonna lie, it's hard to get into, right? Like I think it was like 68% of MDs, US MDs matched into ortho last year. And it's a very good pool. And you kind of need to have your basics of all your good scores and research and everything. And then you got to be that kind of good person personality wise when you show up to your ways. So very important. So I definitely would recommend, and that's like a totally different meeting on how to, be able to have the time management and research skills for that. Me personally, I believe it was like 9 publications. Um, I believe 3 or 4 of those were first author, a couple second author, and then I had around, I think they called them like research items on ERAS. I had around 27, and um, that combines like oral presentations, podium presentations, and abstracts. So, yep, I mean it's definitely important. I don't think you have to get up to those kind of numbers. I think some of my classmates had like maybe 4 or 5. I know people that have matched with like 2 or 3 publications, but I think at least having some research that you're able to talk about and be passionate about and show that it's like helped you develop certain skills that is useful as a person and as a future doctor. Um, but I think there's variability and people have certain strengths in their application um and certain like weaknesses. So yeah, I wouldn't say like, oh, if you only have 2 publications, you're not getting in because it's very determinant on what the rest of your kind of big picture looks like.
Do you do wet lab, mostly clinical?
No, so here's something else I will say about research. I don't think your interviews are going to be very fast. Um, I was in and out of rooms like in like 10 minutes sometimes, 7 minutes of like some interviews. And they literally have a cheat sheet and they have like the number of research items that you have like in like your hobbies category. And I just don't know if people are actually reading up on your research before they kind of talk to you or interview you. So unfortunately, that does mean that sometimes it is a little bit more of like a numbers game. And I think it is good to have a little bit of balance of like, hey, let's put out as much as we can, and then let's have like maybe 1 or 2 like really good quality, like kind of like wet lab stuff, like very clinical kind of research. But no, most of mine was medical education, just like big pool of data that I could analyze, had a big IRB. It was like one IRB for like 4 of the publications. And that let me get through a lot. I mean, I did like a research project start to finish in like a month. And you have to have a good balance of what's the most efficient way of doing this and, what's something that I can do that I can actually talk about and will develop me as a person.
Sweet. Anyone else? Kian, I appreciate you for coming on and speaking with us. Um, and good luck to you. And I hope trauma goes well. Appreciate it, man.
Of course, you guys. Yeah, thank you for listening to me talk. I'll drop my Right now, honestly, it is like a little, I'm like doing some like stupid comedy med stuff on my TikTok right now, but I just dropped my at. If you scroll back to my later videos, I have exactly how I studied for step 2, how I studied for step 1, how I got involved in research more. I have like a lot of videos on that
Yeah.
too, and I'm gonna make some more educational ones. So yeah, hop on there too if you'd like.
Yeah, thanks, man. Kian, appreciate you. Any other questions last minute? Looks like we're good. Have a great night, everyone, and thanks for joining.
Cool. All right. Thanks so much, Tony.